So today we're going to talk about nerve blocks. I have nothing to disclose. Sorry. Oh, you want the volume on?
In case you speak.
Okay, yeah. And just as a reminder now, to get your credits, you have to sign in and do the evaluations. So here are the links. You can access them from the web. Objectives today. So the main point is to talk about ultrasound-guided regional anesthesia. We're going to go through why it's important, when we should be using it, and how we should be using it. Little case. You have an 8-year-old girl who presents in the emergency with a right femur fracture after a ski accident at Blue Mountain. She doesn't have any fever. She's a bit tachycardic, normal blood pressure, borderline tachypnea, normal O2 sats. Her right leg is in a kind of external rotation with a deformation of her thigh that is very swollen, firm, and tender, and the right leg is shorter compared to the left. So you order an X-ray, and the X-ray confirms a mid-shaft fracture. So then she's in a lot of pain. Do you block or not? So let's dig into that a little bit. So first, why should we be doing these local anesthesia? Because other people do it. Actually, if you look here at that study that was done in the States, they asked all the emergency program director, it's only in the States, about use of ultrasound-guided nerve blocks. And it looks like they got only 70% of response rate, but still with that, 84% of these centers would use the ultrasound to do nerve blocks. So it's definitely something that is done and is actually quite useful. And so for what do they use it? So they use it mainly for forearm and femoral nerve blocks, but also for a lot of other nerve blocks. And it goes down to paravertebral nerve blocks. So, I mean, the point of this topic is not to go to these like very fancy kind of applications, but we're going to look at the one that they use the main. Indications are made for pain control. So it's either just a pain control because there is a fracture or something that is painful, or for the procedure that you're going to need to do to fix your patients. So laceration repair, reduction of the dislocation, abscess drainage, or foreign body removal. So there is a lot of indications. They teach that. So mainly doing didactic sessions or use of online sources. So these both things are not so difficult to do. Then supervised practice on real patients. That might be a little bit more challenging depending on where you work. Some sessions using phantoms. That is also something that is not so difficult to do. Phantoms are very easily found, or you can also do your homemade nerve block phantoms. It looks like 8% of these centers would do that. Another reason to use AGRA would be because it's best practice. So is it really best practice? Cochrane review that was done and showing that nerve block by ultrasound guidance compared to nerve block without ultrasound guidance is better. So you get a better block, sensory and motor. It reduces the need for supplementation, meaning that then you don't need as much other pain managements as opioids. You have fewer minor complications related to the procedure, and you also do your procedure faster. And that was done looking at 32 RCTs. So especially in anesthesia, a lot of people would be doing that without ultrasound, and even in the emergency. And I guess just because of the legal point of view, in the States, they started using the ultrasound more and more. But there are a lot of places in Europe, at least, where no one would use the ultrasound. Yeah, and even here in the OR, they don't use as much the ultrasound. Yeah. But I mean, they do nerve blocks all the time, anesthesiologists, right? So they're kind of used to do it. It's not the same for us in the emergency. We don't do that as much. So if there is something that can help us being safer, And for us, definitely workflow is important as well. So if we are faster doing that with the ultrasound, let's use it.
Arguments can be similar to go back to the time of central lines being implanted. That most institutions would say that the volume literature has evolved to the point to suggest that that's just an unnecessary risk. There's still lots of people out there who are like, yeah, but I can do it. Like I always did it that way, and I'm pretty good.
Yeah.
But we know that for all comers,
not Cochrane, but looking at the same things are also getting into this, finding the same conclusions that the block is better, works better. You do not need as much supplementation, not as much complications, and it's faster. What about in pediatrics? So here's a Cochrane review for blocks in children. So it's also mainly looking at papers done by anesthesiologists and not as much by emergency doctors. But they found 20 studies, including 1,241 participants, and just have the same conclusions, basically. So increases the success rate, and the younger the patient is, the better it is. The block would last longer, and that is actually due to the fact that you actually inject your anesthetic around the nerve better and not as much in the surrounding tissues. So it's going to stay around the nerve for the longest time. And then it works faster as well because you are closer to the nerve. And it reduces the number of needles passed, meaning that it's not as painful then. So it looks like it's actually safe to use the ultrasound, and it's actually even safer than not using it. So here that was done, it's a study that was done in India in a trauma center level 1. They get approximately 50,000 admission a year, and it's children and adults. So their patients were from 5-year-old to adults. They got 50 patients, and doing blocks for these patients was efficient. The procedure would take 9 minutes. They got a very good pain relief that was usually there within 5 minutes. They got only one failure because they didn't inject the medication close to the nerve, and no complication at all. So, because we're going to go through the complication a bit later, but that's really something that is very, very rare. So for sure, with 50 patients, you're not going to catch complications probably. But yeah, it's reassuring. So it looks like if you look at the literature,